Health care for more than 1 million Oklahomans may become more difficult to access soon as the state's Medicaid agency waits for federal budget cuts. Cuts that are coming because the state's economy is seen as being so good, but when in reality, only a few are actually reaping that benefit.
A survey of the 50 states by the Kaiser Family Foundation has found those states that did not expand Medicaid as part of the Affordable Care Act have seen their cost to provide health care increase twice as fast as states that did expand Medicaid benefits. While Oklahoma is one of the states that did not expand Medicaid, costs have not actually gone up, according to Nico Gomez, Chief Executive Officer of the Oklahoma Health Care Authority.
Our budget tension is on the loss of federal funding that's due to a formula that says how well your economy is doing compared to the rest of the nation, then you're going to receive less federal funds, and that's really what's putting the strain on us.
A strain that may cost the agency between $50 and $80 million. And here's the ironic twist. The reason for the federal funding cutback is because of a booming state economy, but booming only for a few, and for people who do not use Medicaid. Since 1979, income growth in Oklahoma has gone disproportionately to the wealthy. Even during the Great Recession from 2009 to 2012, incomes of the wealthiest 1% of Oklahomans grew by nearly 40%. The remaining 99% saw growth of just 3.5%. And 1.2 million of those people are on Medicaid, most of them children.
We provide health care for kids, pregnant women, seniors, and individuals with disabilities, and the number of people in those categories in low incomes continues to grow. So I don't know the solution to that, but that's what we're dealing with.
Medicaid expansion does not seem politically possible, in part because of concerns the state cannot afford additional Medicaid expenditures when federal funding begins to go down after next year. Now enter the Oklahoma Hospital Association.
Through the supplemental hospital offset payment program that we already have passed and the legislature has extended, that we're willing to look at using that means to help the state put up the money that they believe is going to be at risk.
According to the Oklahoma Hospital Association, in 2014, hospitals paid SHOP assessments of $196 million and got back supplemental payments of $461 million.
When you look at the state's economic situation right now, there are easily dollars that the state of Oklahoma is paying 100% for right now that would be totally offset by this proposal.
Jones believes this deal is a really good one for state government, especially now.
And when you look at the urgent situation in education and other areas of the state's budget, this isn't necessarily a total solution, but it is a significant contribution to helping with the budget deficit that the state has.
If the Hospital Association's board agrees to the plan, a series of meetings are also planned around the state to raise some grassroots support.
Small communities, large communities across Oklahoma, meeting with community leaders, business leaders, sharing with them this is the impact, the economic impact on your communities, both in terms of the hospital, but the community and region at large, by what it means if these dollars get infused in.
The association estimates the impact at 24,000 new jobs, a net increase in tax revenues through income, sales, and other taxes of over $400 million over several years. David Blatt, executive director of the Oklahoma Policy Institute, says the Kaiser study makes it pretty clear that expanding Medicaid is not going to bankrupt the state.
Pretty strong conclusion that if states like Oklahoma that have not expanded were to go ahead and do that, that it would actually create some savings for us, less pressure on the state budget.
And so, if the offer comes through from the Hospital Association, Blatt says it's just too good an offer for the state to pass up.
And has all the other benefits of providing the ongoing access to coverage for low-income workers, allowing them to be in better health, helping businesses have a healthier workforce, helping hospitals and other safety care providers have to deal with less uncompensated care.
But for now, Medicaid healthcare providers have been warned that their reimbursement rates may be cut again very soon, something that would likely reduce access of healthcare for hundreds of thousands of Oklahomans.
These are more than numbers. These are lives. These are people that we care for in the state of Oklahoma. More than 1 million Oklahomans' lives we will touch each year, and this is their services that we're talking about.
Over the last 2 years, more than $280 million has been sliced out of the state's Medicaid program, a total that is on track to grow even more in fiscal year 2017.